Hello everyone, I am Devesh Bhute from Bhadane College of Physiotherapy, second year. So today we are going to learn about goniometry. Goniometry basically is the process in which we measure the range of motion of a particular joint using an instrument called goniometer. Goniometer is derived from a Greek word which is gonio means joint and metron means measurement. So there are basically four types of goniometer: universal goniometer, pendulum goniometer, gravity dependent goniometer and inclinometer. So today we are going to use universal goniometer. This is a full body universal goniometer. This is the fulcrum. It has a stable arm and a movable arm, and this is the body.
Everyone, myself Chetna Bhadane. My friend Devesh has already told about the necessary things about goniometer. Now I'll be putting lights on the principles of goniometry. The principles of goniometry are: firstly, we give the proper position to the patient. Then we for the stabilization, we stabilize the proximal joint of the patient so that there is no trick movement occurring at the joint, and we get the proper range of motion. Then after fixation stabilization, we go for the checking range of motion. Firstly, we check the active range of motion, then we go for passive range of motion. Further, we get passive range of motion along the proper end feel. End feel can be of two types. There can be a soft end feel, there can be a firm end feel. Soft due to the muscle bellies and firm due to tension between the ligaments over there. And after the proper range of motion, we go for a hypermobility.
So now we are going to perform goniometry for cervical region. There are basically 7 cervical vertebrae, but the flexion and extension movement of the neck is performed in the atlanto-occipital joint. Side flexion and extension of the so now we are going to perform flexion movement of the neck. For that, the fulcrum of the goniometer will be the external auditory meatus. The proximal arm should be the imaginary line joining the external auditory meatus and the tip of the nose. The distal arm will be perpendicular to the ground. So for performing the movement, I will first stabilize the goniometer and the proximal arm. Now I will perform flexion movement. Okay. So now the range is 65 degrees. Normal range is 60 to 90 degrees of the flexion. Now we will perform lateral rotations of the neck. For that, the fulcrum of the goniometer will be the vertex of the head. The distal arm will be the imaginary line joining the vertex of the head to the tip of the nose, and the distal arm will be the imaginary line joining the two acromion processes. For that, I will first stabilize my fulcrum and the proximal arm. Now I will perform the movement, side rotation. Okay. Now it is 75 degrees. So normal side rotation of the neck is 60 to 90 degrees. Now the flexion and extension of the neck is performed in the sagittal plane and coronal axis. Side flexion of the neck is performed in coronal plane and sagittal axis. And side rotations of the neck are performed in transverse plane and transverse axis. All the end field of the cervical region are firm.
Hello sir, today I'll be measuring your knee joint range of motion using the goniometer. We are using the universal 360 degree goniometer so that we can get the exact range of motion. So can you please lie down in prone position on your stomach? So I had given the relaxed prone position as pillow is given under the head to reduce his cervical lordosis, and the position is maintained. This is the body of goniometer. This is the fixed arm, which is also known as proximal arm, as it will be placed proximally. This is the moving arm known as distal arm. The fulcrum of our joint is lateral lateral condyle of femur, and the proximal arm, which is fixed arm, which it will be placed along the imaginary line joining the greater trochanter and the lateral condyle of femur, and the Distal part will be joining the lateral malleoli of the fibula. Now you have to flex your knees, sir. Now here I get the soft end fill. Firstly he had done actively, and then I confirmed it with applying the pressure, doing the passive movement, and the range of motion is 140 degrees, as the normal range of motion is between 120 degrees to 150 degrees. Henceforth the patient is normal, having the full range of motion. Now let's see for the extension. The extension is given in the measured in the same position. Just we have to take knee to the full flexed position, and then we will bring it to the neutral position. Just hold this position, sir. So as we can see, the patient is having full range of motion. Um, Thank you.